Hello, dear aquarist, dear fish keeper. This study that I present for you, I selected from several articles that I came across when I go on the internet, and new publications appear, new studies, and also some old studies that might be of interest in our work when you try to treat our ornamental fish. So in this case of study, I present to you, we will evaluate the treatment of gill flukes belonging to the family of the Dactylogiridae and what can be the options to treat in a short-term way of eliminating the gill flukes, particularly when you deal with large fish, expensive fish, particularly when you're breeding fish, but also when you keep fish and you want to control an infection immediately when a fish is infected with it. I also have some critics when it concerns the use of our aquarium in our hobby. So let me share you the study that I would like to discuss with you and the different studies. It's about the use of trichlorfon. Trichlorfon or dialox, or used to be called mazotan, has been used many, many years ago in our ornamental industry, but it's very poisonous for mankind, and you have to be very careful of using it. And in many practices, it's been banned to be used or not allowed to be used unless on specific conditions. And the trichlorfon is here discussed as effective against Dawestrema cycloancistrium. Wow, sounds very scientific name. So let me show you who is Dawestrema or what is Dawestrema that has been found on an Arapaima, the Arapaima gigas, a large neotropical fish from the Amazon, studies done in Peru. So the Arapaima is a very important fish for the aquaculture, fish food industry in South America, but also for some fish hobbyists. And that Dawestrema in this article discusses that it's a kind of Dactylogiridae, a gill fluke, that has been found in Peru on the Arapaima. And so this article discusses that they identified that species. I will give the links below in my details of this study so you can look up for yourself. And it shows the photographs of the diagnosis of this gill fluke, a lot of details. This is the photograph of this kind of gill flukes. Here are the hooks, and here are the black pigmented eyes, the eggs it can have, the hooks it has. So it's a gill fluke that has been found on Arapaima. And in this study, they checked what is the effectiveness of the trichlorfon and can it be having a negative effect on Arapaima. And to give a short summary of it, they did therapeutic baths of 60 minutes. They did it 2 times within 24 hours. A therapeutic bath, and they found out that 150 milligram trichlorfon or dialox can be used in a therapeutic bath to control and to treat this gill fluke with no physiological impairment. That means no damage to the fish. And that's important. First of all, it's a short bath, 60 minutes. It's only 150 milligrams per liter. So you have to take out the fish. You cannot just put it in your aquarium, affecting it to other fish. Be careful. On the other hand, you have to be aware that it's a gill fluke that produces eggs. So within 1 or 2 weeks, the eggs may pop out when you put the fish back in the aquarium or in the pond, and then the eggs can reinfect. So in this case, well, the trichlorfon will not eliminate the larvae or the eggs coming out within a week or 10 days. At least it destroyed the gill flukes, which were on the fish on that moment. So for this case, it's interesting. It was very effective. 93% is very high as a therapeutic bath. There are some other studies done on the use with garlic. And that's why I want to show you the study on the garlic used against this Dawestrema, this gill fluke, and also the use of garlic against Trichodina, another ciliated parasite that can affect the Arapaima, called in Latin or in South American language, I would say Pirarucu is the common name used in South America. And here they observed that the garlic concentrations they used 0, 2.5 milligram or up to 5.5 milligrams per liter, there was some intensity reduction to the control, but no differences were observed between the tested concentrations. So the efficacy of the baths against monogeneans, the gill flukes, was below 40% for all treatments. So be aware, garlic is not a good suggestion to use. Then you better use Trichlorfon. But anyway, it reduced something, but it was not observed to have a difference. On the other hand, for the Trichodina, there was an increased number of dead parasites observed in the fish exposed to the garlic. And the best, highest efficacy concentration was 5 milligrams per liter. So think about it, that a concentration of 5 milligrams per liter of garlic for 96 hours, so you're talking about several days to be used, about 4 days, it really had a good impact on the Trichodina parasites. So something to think about, to use maybe in your aquarium or in your pond. It's a cheap, well, natural herbal medication to be used for parasites control like Trichodina. And I will in the future try to look up other articles where garlic might have an impact on other parasites. And I would say I have seen articles also on cryptocarrion or white spot disease or ichthyophthirius that garlic might have a positive impact. Not perfect, but anyway, a practical tool which is available near you, easy to get without prescription. So natural treatments can be a help. So this summarizes a little bit some options what you can use for gill flukes, like the old product Trichlorfon, but as a short bath to eliminate, or garlic as an option not to treat flukes. That has several studies already proven, but maybe to treat protozoan parasites like ciliates, like ick, and here in this case Trichodina. So follow my studies. I will publish some more on the use of garlic or other herbal medications. And I can tell you, in my experience as a fish doctor, I have been using herbal medications in the fish food to help the fish during the feeding process, because feeding is very important for restoring health, restoring immunity. So we have immunostimulants, we have probiotics, prebiotics, but we also have products like lapacho or fuco or moringa, all natural products that helps the fish to recover, to fight off infections in combination with medications. So think about options you can use of treating your fish. And these studies are a little part of my work I present for you. So stay tuned, subscribe to learn more.